Welcome to the podcast, and this video is gonna be really a special because first time we're gonna do the podcast with two dentists which are very well known. And personally, I have seen their journey, and I love the way they maintain their personal and professional way. Please welcome Dr. Sagar and Dr. Joveria, who is one in masters in oral surgery and one in prosthodontist. Here, we're going to learn about how both the dentists work together, how they plan the cases, is there any conflict between them, so how they solve it, and before delivering the full mouth cases or a veneer cases, how they plan the cases. Personally, I have learned a lot in this podcast, and here I'm going to share with you all that how to maintain each and every relation and your work and do the best to the patient. So let's dive into the podcast and learn about it, how to manage the time, how to manage your relationship, as well as how to maintain the professional way and do the best outcome possible.
So, hello and good afternoon. So, first of all, thank you so much for taking out your time. Especially on Sunday, मुझे पता है कि कोई ready नहीं होता है, but still you both manage. So, thank you so much. And today we're gonna talk about your personal journeys because when I was इन डीवाई पहले मैं क्लियर कर दूँ कि हम सब डीवाई से हैं एंड मैंने हमेशा आप दोनों को देखा हुआ है कि एंड मैं तो भाग-भाग के आती थी कि मुझे हेल्प कर दो। बट आई नेवर थॉट कि मुझे अपॉर्च्युनिटी मिलेगी। सो नाउ फर्स्ट आई नीड टू आस्क यू वेरी बेसिक कि हाउ यू बोथ गेट इनटू अ डेंटिस्ट्री? वाज़ इट योर फर्स्ट चॉइस? Do you love dentistry today? So I just want to know about that first.
Uh, to be honest, I don't think it was my first choice. I always wanted to be a lawyer
Wow.
and complete
Wow.
profession or career shift. So I always wanted to be a lawyer. Having said that, dentistry was also on the cards. I have a lot of family members who are dentists. My aunt, my uncles. So बचपन से उनके यहाँ पर आना जाना लगा रहा. So I was very fascinated by the chair and the machineries and how
Yeah.
things work. But yeah, but I don't know, something changed and I landed in dentistry.
So for me, my entire family is of all MBBS doctors. My father was an orthopedic surgeon, mom's an anesthetist, grandparents are physicians. So my first choice, like every other kid, was MBBS. But then I realized that I want to do something different from the family. So dentistry was my second choice, but I'm very glad that I did that and not MBBS. Eventually, I did oral surgery, so it's somewhat like a bridge between dentistry and the
MBBS,
surgery.
yeah.
But yeah, that's how I chose dentistry.
एक्चुअली टू बी वेरी ऑनेस्ट मैंने जब किसी के साथ पहले भी एक बार पॉडकास्ट किया था, हाँ, डॉक्टर हर्षदीप, सो हर सिस्टर इज MBBS एंड ही इज अ डेंटिस्ट। तो जब हम बात कर रहे थे कि डू यू वांट डेंटिस्ट्री एज फर्स्ट चॉइस, ही वाज लाइक नहीं, but now he is more grateful
No,
because
that is very true for I think the both of us that we are very very glad that we took dentistry. It may not have been our first choice, but now in retrospect it was the best choice for us.
बट मेरे लिए तो फर्स्ट चॉइस था, टू बी ऑनेस्ट। मतलब माय मॉम डैड
Wow.
वांटेड कि मैं डॉक्टर बनूं और मैं डेंटिस्ट बनूं। आई डोंट नो व्हाई। माय डैड वाज बिहाइंड।
Fulfilling
Yeah,
their
yeah.
dreams.
एंड एंड उनका एक और था कि मैं डीवाई में ही एडमिशन, मैंने कहा कहीं और बोल देते तो थोड़ा चेंज हो जाता, बट दे वर लाइक नो डीवाई चाहिए और तू डेंटिस्ट बना है। लाइक ओके, और जब मैं अभी उनको बोलती हूँ यार लाइक हाँ ठीक है, अच्छी बात है। हम लाइक व्हाट मतलब और क्या चाहिए आपको? वो खुश हो जाए, मैं जब उनको ट्रीट करती हूँ, दे आर लाइक हाँ अब तू कुछ डेंटिस्ट्री कर रही है। मैंने कहा ओके थैंक यू, थोड़ा सा तो प्राउड होना स्टार्ट हुए। बट नाउ आई वांट टू से कि दोनों फील्ड, ओरल सर्जन एंड प्रोस्तो, मेरे लिए एक अलग ही डिफिकल्ट लेवल है। मतलब ना ही मुझे वो जॉ रिलेशन अभी तक समझ में आया है। मुझे तो बहुत बहुत डांट
He has
पड़ी
also
है।
not understood till
It's
now.
so difficult, मतलब ये मेरे का नहीं हो रहा है। एंड आई रिमेम्बर आप थे तब जब मैं भाग के आती थी मॉर्निंग्स में कि
Jaw
मुझे
relation
जॉ
को help करना है।
रिलेशन हेल्प कर दो प्लीज, वो नहीं आना था।
So I think jaw relation ऐसी चीज है जहाँ पर a lot of people have heard struggle.
या इट इज
एंड मे बी अंडर ग्रेजुएट में हमको इतना ज्यादा एक्सपोजर नहीं होता, वी डोंट गेट टू डू सो मेनी जॉ रिलेशंस. व्हाट आई हैव अंडरस्टूड, इट्स नॉट ओनली थियोरेटिकल. वो कर करके यू स्टार्ट अंडरस्टैंडिंग. यू हैव टू गाइड द पेशेंट विल नॉट गो ऑन इट्स ओन. यू
करेक्ट।
हैव टू अंडरस्टैंड. सो इट्स लाइक मसल मेमोरी, फिर वो याद हो जाता है करते करते. हमको क्या क्यों देना है पेशेंट को, क्या बोलना है टू गो इनटू दैट करेक्ट पोजीशन. And I think it's about that, and it
अरे
takes
पर वो
time.
माउंटिंग भी तो डिफिकल्ट थी।
That I also agree.
और वो माउंटिंग ही मेरा कभी राइट चले जाता कभी लेफ्ट सीधा ही नहीं आता था। एंड आई वाज लाफिंग ऑन दैट टाइम। स्टिल मुझे नहीं आता।
But that's okay. Now you don't have to mount.
आई होप सो नहीं करना पड़े। बट बिकॉज मैं जब भी आई डिड अ पॉडकास्ट विद दर्शन सर एंड अली सर, जब हम बात कर रहे थे सो दे वर लाइक कि नहीं यू हैव टू डू द जॉ रिलेशन, तो बाइट रजिस्ट्रेशन और वो सब करना है। मैं उनको सिर्फ सुन रही हूँ कि ओके, मैं डाइजेस्ट कर रही हूँ कि ठीक है कभी आई विल स्टार्ट इट, बट इट इज़ वेरी डिफिकल्ट। पर जहाँ पे मैं ओएस की बात करूँ, ओएस मेरे लिए पर्सनली इट वाज अ लाइक ऐसे अलग ही लेवल का था। जब एक्सट्रैक्शंस करने आते थे, आई रिमेम्बर वो एलिवेटर यूज करने नहीं देते थे एक तो हमें, तो वो बहुत ही ऐसे फुर्सत में हालत टाइट हो जाती थी, पर एक डर लगा रहता था।
So, if you ask me, the best field, in my opinion, dentistry has to offer is oral surgery. If you want to be an oral surgeon, you do it only for the love of surgery, nothing else. Extractions, elevators is a learning curve. Once you know it, then there's no going back. The thrill of going into an OT, the thrill of doing a mandible fracture for the first time, or even implants or doing onco. Though I don't do onco on my own, but in general, onco, orthodontic, these surgeries are very, very thrilling. It's a different way of life. You have to dedicate your whole life to it. Only then is something that you should do oral surgery. But it is the best field. The only field that I would have done after BDS would be oral surgery. Baki koi field, I don't think it's not for me.
गलत जगह बोल रहे हो।
It's not for me. It can be for someone else, but not for me.
नहीं, बट हियर ओनली आई वांट टू आस्क कि ऐसी क्या वन ऑफ द थिंग कि आप ओरल सर्जरी में आपको बहुत ज्यादा पसंद है।
I think the whole field, the orthodontic surgeries, I love. Zygomatic implants, the complex implants that we do are a field.
Why do you love oral surgery? But
There is no specific reason. Um I love oral surgery for the thrill of it. I love everything. You actually change a patient's life. Someone who's come to you with a trauma, someone who's come to you with a cancer in his mouth. It's a life-changing surgery. Someone who has always been shy of his or her looks due to a prognatic mandible.
correct.
No, it changes the person's life from that point on.
Yes.
So I like oral surgery. It's actually something that you can give back to a society or to a person. And for me, it is the most thrilling, like the most adrenaline rushed feel that you can do. That's why I like. And
Yeah.
plus, my family has been into surgery, so that's one thing that always excites me. Hence,
That's
surgery.
true. Because when we were interns, तो हमें OT आना होता
Yeah,
था।
yeah.
पहली बार तो I was very excited. I remember I was the first one in our batch to go to OT.
So I'll tell you, in our internship, the only posting I've actually attended
It's
was oral
OS.
surgery. Every field from prosto used to run down to OS. From endo, we used to run down to OS.
I would like to say I have attended everything.
She was a sincere,
I was
sincere.
a very sincere student. I have not missed a single posting, lecture, or any department.
Wow.
You can ask my teachers.
Wow. So what makes you love prosthodontics?
I like how prosthodontics is the base of dentistry, is what I believe after doing and understanding prosthodontics. Like every field revolves around prostho, or there is most of the fields, I'm not saying every, and how it needs prosthetic intervention either in the stage of diagnosing a patient, or towards the end of the treatment, like finishing a treatment. So I like how we are always involved in either diagnosing or finishing a case. I believe that we are there everywhere. लाइक जहाँ रूट कनाल खत्म होता है वहाँ प्रोस्थो स्टार्ट होता है,
Correct.
जहाँ प्रोस्थो खत्म होता है वहाँ ओरल सर्जरी स्टार्ट होता है. सो इट्स लाइक either we are finishing somebody's job or starting something for
Something
somebody
for-
else.
yes.
So I think I like that, like you are almost involved in every part of the patient's treatment plan.
Correct.
So yeah.
And to be very honest, why I love this both field is, जब से I have started my implant fellowship, first of all, surgery was something I always liked, but I never want to get into OS. The only reason was the long hospital hours. I was not able to give. I know that. Keep. I will not able to give that. So we should know where our limitation
What our
is.
limit is, yes.
Yes.
100%.
So I never went there, but I love surgery. That's why I get into the implants. If someone asks me, many people ask me, ki, why implant? After you did your masters in UK, why you want to come again and do implants? There is a reason. So this is my reason. But what I love about OS and Prosto combined is OS gives a life. I feel because बहुत सारे patients when I was treating, चाहे मेरे simple case होंगे अभी, but I was able to see that smile on their face कि we have to eat. हम खा सकते हैं, हम इस दुनिया के मजे ले सकते हैं, because after all खाना is a priority. So they love it. And what I love about Prosto is the way we give them a teeth, they feel confidence in the world. So whenever where I'm working right now, and when I see FMR cases get delivered, the different smile they give to us कि डॉक्टर आपने तो हमारी कॉन्फिडेंस दे दिया, अब हम खुल के हंस सकते हैं. That is something I feel each and every doctor crave for.
True.
So that's what I love about OS and Prosto. एंडो मुझे पसंद है, बट ना मेरे लिए वो बहुत डिफिकल्ट है. मतलब आई
Same here.
रूट कैनाल वो बहुत पेशेंस वाली बात है और वो मेरे में नहीं है. सो दैट्स व्हाई आई नेवर गॉट इनटू एंडो. देयर इज नो एनी पर्सनल ग्रजेस, बट मुझे ऐसा एंडो नहीं पसंद था. बट ऑर्थो एंड ओएस एंड प्रोस्टो यस. एंड अगर मैं सच बोलूं, इंटर्नशिप में दिस टू फील्ड वर समथिंग जहाँ आपने मुझे बहुत देखा होगा.
Yeah.
प्रोस्टो
We
में
have seen you slog run from
Yeah.
one room to the other
आई रन
with cast in hand, with everything in hand.
बहुत डांट खाई है मैंने, मतलब मैं बता
Stuck in a tooth for 2 hours.
yes, I still remember.
I know it was stuck.
I was stuck and I was like, फिर भी अलग थी कि मैं ही करूँगी चाहे जो भी हो जाए. बट yes, I got a great mentors जिन्होंने मुझे हिम्मत हारने भी नहीं दिया. So I would say that. But PG is something is very difficult. तो ऐसा क्या toughest point था आप दोनों के लिए in your PG level that is something that you can never forget but always grateful that moment?
So for me personally, in oral surgery, the first year of PG is supposed to be the toughest, where it has a lot of grunt work, a lot of paperwork, a lot of admissions, discharge. It's a whole lot of paperwork for each and every patient, as you're associated to the hospital. Full night casualties, then you come back in the morning, do the same dental OPD, go back in the wards, do the patient work. It was the toughest time, but now in retrospect, I feel that was the best time of PG. If given a chance that year, I would be still on board to repeat, but compared to the second or third year. But yeah, first year is difficult. That's when most of the people lose confidence that शायद ये मुझसे नहीं होगा, this is too much for me, because you're putting on 18 hours of work every day. You don't have a proper sleep or eating schedule. You can't visit your home. It's a residency, you have to stay there. But that is the most fun part. In retrospect, that is the best part of residency. But yeah, if you ask me the toughest thing, yes, that was tough for me in the beginning to get used to it.
And for you?
For me, I think the change from UG, from undergrad to postgrad, undergraduate is something, it is very institutionalized. You have lectures, it's like ye sab karna hai, everything, a table timetable is set for you. But PG was completely different. Like how you said you felt like ye kaise karna hai, when I entered into PG, things were so different. I was waiting for some direction कि okay अभी ये करना होगा अभी ऐसा. But no, you have to make your own timetable there. You have to decide what you want to learn from this course, and how you want to take it. So initially it was very difficult and confusing, because I didn't know, to be honest. This is my personal experience. I didn't know what to do, how do I start, or where do I start. But again, with the guidance of good seniors, good teachers, good professors, and our guides, I was able to find myself, okay, what I need to learn. And by the end of it, or while I was going through PG, I understood, I knew what I want to learn. This is my area, this is my forte, I want to do this, and this is how I'm going to do it. So initially it was very difficult to get that hold, but once I got it, I was very confident, and I like that about myself. And I like now how it is helping me, because in any situation I know I can do it. I know how to, मुझे खुद ही अपने लिए सब decide करना है, what I want, how I want, and how to get it. I think that's what I learned from my PG, and I am very grateful for that. So
Yeah.
that's what I learned.
That's really true. But अगर मैं आपको एक चीज बताऊँ, when I was in internship, I think when you both were doing PGs,
More or
so
less, yes.
yeah, I remember your तो एकदम अच्छे से, because I was there ऐसे थे.
In the room.
मेरे ख्याल से मैं वो बच्ची थी जो घूमती रहती थी पूरे हॉस्टल में. But what I have seen is the dedication you both showed. मतलब वो बहुत ही अलग लेवल था. We are laughing on this right now कि mounting और ये सब, but यार it was such a something task, but you never give up. And for you I will say कि सर्जरीज हम बोलते हैं कि हाँ हमें बहुत पसंद है, but we know the behind that chair, it's it's something that we give everything, because even a simple surgery,
requires a lot of effort.
lot of effort, lot of dedications, and lot of trust. So I have seen कि आपने कैसे ट्रस्ट बनाया है पेशेंट पे, आपने कैसे वो पेशेंट ने आपके ऊपर छोड़ दिया है. So when I was doing a podcast with Darshan sir, he told me a very good line, and वो मैं अभी सब पेशेंट पे डालती हूँ. मतलब I say them, especially in my implant first case. I still remember मैंने story डाली हुई थी कि, and that patient was so happy with me, but he told me one thing कि when I asked him कि patient आपको कैसे trust करते हैं, they are not scared, they tell कि we say अगर हम डरे हुए नहीं हैं तो आपको डरने की ज़रूरत नहीं है.
That's something we tell our patients every day. You should not fear till you see a doctor getting
Doctor
scared.
scared. Yeah, and that's what I love, and I have seen both of you actually personally. मैंने देखा हुआ है. It's not कि मैं यहाँ पे बैठी हूँ इसलिए मैं बोल रही हूँ, because there are some seniors मेरे life में who has turned my journey. चाहे मैं 1.5 year पूरी गायब थी, but still when I came back, I have that known faces around me. So it was something कि मेरे लिए बहुत ही वो था. But अभी ये पूरे जर्नी में देर आर ऑलवेज, हम एक क्वेश्चन के साथ रहते कि हम ये कर क्यों रहे हैं, एंड वी ऑलवेज आर इन कि वी वांट टू गिव अप. तो डू यू बोथ हैव दैट थिंग ड्यूरिंग योर जर्नी कि आई वांट टू गिव अप, ये मुझसे नहीं हो रहा है?
So fortunately for me, and I'm sure for Joeria also, we don't think we ever at a point that we wanted to give up. We do this out of our own whim. We do this because we love this field. It gets tough at points. It gets scary at points. It gets cost you a lot in personal life at some point. But we were never at that field that we want to give up. Even from the day we started our PG till now, in 4 years into practice or whatever, we have never felt that we made a wrong choice or that nahi hoga. We knew that something we will manage. That's what at least I'm sure she agrees with.
I would like to add something. A lot of this is also because we are there together as partners also, because we can, like, we are in the same boat most of the times. Though हमारी boats different है, we are going in the same direction. So we can talk to each other about our personal and professional issues, or if we ever feel like that. And there's always the other person, if one of them is going through something, to take care of the other person, personally and
Good
professionally.
support is very important.
Yes.
Good family support, good partner support, good friend support is very important.
Yes, and that's what we got
Good.
in each other.
So
that helped.
now you took this point, I want to ask कि आप दोनों मिले कैसे?
Who would like to say
I'll
that?
try.
It's a very
I'll
funny
say
story.
that. So luckily for both of us, we both failed the same exam in first year. That bloody carving exam.
अरे यार.
I couldn't carve for the end of me.
Both our families broke.
Yeah.
The final university
And
exam.
we had to give the same exam together again. But in retrospect, it was the best thing that happened that we failed. At least one exam we failed in life. That we have never failed in any. We have been lucky enough to get distinctions in many of our subjects, but that one exam that we failed, we both failed, and we both had to be together.
So we met each other. That's how we met each other. And I mean, yeah,
Yeah.
it started from there. That's how we met each other, and everything started from. I think we are very. And then we learned a lot personally and professionally from there. Everything changed from that point in time for both of us. At least for me, it completely changed.
I attended lectures because she was there. She used to take me to the lecture. I never used to attend any lectures before that.
Wow.
He's more of a practical person.
हाँ.
Practical करेंगे ना, patient पे करेंगे ना. And I am somebody who likes to always be prepared.
दिख गया वो तो.
Not with a plan, with everything. Plan A, plan B, if this doesn't work out, that.
Yeah,
I am like that. So completely different personalities, and then when we meet, it's yeah, he's
And I
more of-
agree with you क्योंकि जब मैंने ये बोला पॉडकास्ट करना है, he was very chill. हाँ ठीक है कर लेंगे. And you were like क्या करना है बताओ. And when I came here, I'm like you have been surprised. I have changed everything and मैंने तो कुछ किया ही नहीं है.
yeah, because I was preparing myself, you know.
That's what happened during the NEET exam.
That's a funny story. You should know that.
We both gave our NEET when we were in our internship. Okay, so Joeria used to study a lot, like every book, she made me enroll in some God forsaken some classes, and I never used to study. So she used to panic that तू पढ़ ले, मुझे मिल जाएगा, क्या कैसे चलेगा, तुझे नहीं मिलेगा, you'll have to take a drop here. And on the day of the exam, I was not even sure if I was going to go and give the exam because I was not at all prepared. And she like, nahi, exam de de. We gave the exam, everything. When the marks came, like I didn't even know what my hall ticket number was or how to check it. And I had just given it for namesake. Luckily, something happened. I scored 2 marks more than her.
Wow.
And she didn't
What happened?
speak to me for the rest of the day. As if I have done something wrong.
I would like to add something here. जो आज हुआ है ना, सेम वो चीज पेपर में हुआ. I prepared throughout the year for an exam. And exam year में हमारा जो साल हमारा नहीं था,
Yeah,
everything
yeah.
flipped. In the sense, कुछ भी जो मतलब one would expect,
Yeah.
ये आएगा, ये पढ़ लेते हैं. It was not like that. It was based on all, मतलब everything, general knowledge type जो आपने, अगर आपने पूरे 5 साल पढ़ाई किए हो, first year, second year, third year, final year, then you would be able to answer that. And I was like, hey, I was so preparing for all other MCQs and it turned. So it was a bittersweet feeling. I was happy that he made it. Same marks. But I was sad that he got
वो
marks.
एक रील आते ना
She was
जो
not happy.
3 Idiot के, I remember that scene कि दोस्त जब फेल हो जाए तो बुरा लगता है, बट दोस्त जब ज्यादा ले आए तो बहुत बुरा लगता है.
Because yes, मुझे बुरा.
She actually didn't pick up my phone.
I'm sorry, but I was happy also.
We got the same college. We both had got post graduation in MGM.
Oh.
15-20 days. But then we both realized that it was not for us. So we both shifted our college back to DY.
DY. So अगर OSS really मतलब ऐसा है ना कि टाइम नहीं दे पाता है, how do you manage? मतलब प्रोफेशनल और पर्सनल को दोनों रखना.
So the 3 years there's no personal life. Like
Wow.
yeah, first year second
There
year.
is only professional life when you're doing residency.
Were you ready for
Yeah.
it? Or
If we want to do something big, then we have to
be
get
ready?
somewhere. Like for us, it was very sure that we are going to do MDS. Uske
Hmm.
आगे what fellowships we do or whatever is still optional, but to do MDS was something that was always in our books, and we were more than happy to dedicate it. Our families both personally have paid a very high price for us to do MDS, so we always had that dedication that no, we will do this. Personal life can take a back step for some time, and ऐसा नहीं है that we don't get personal life. We did meet in college, we did meet in a party also, we had our own time, we had a good time.
Hmm.
ऐसा नहीं the time नहीं मिलता, you get a lot of time, you have to find time, but at the same time you have to understand that why the
नहीं दे
guy
पाते थे.
why your partner is not able to give
Yeah.
you time. And because we are in almost the same field, we understood. She saw how tough OS was in the first year. I saw how taxing prosto gets when you have so much lab work. So we
Correct.
know why the other person is not there.
And what I would like to add is we had a lot of support, not only in each other, but the families as well.
Hmm.
We were always supported from all the sides to be able to, we were motivated enough to, get through the 3 years of post graduation. So it was not easy, but I think we had the right support in all forms from our friends, families, and each other to, get through PG. So I think that helped.
That's true.
If you do the subject you love, then all this you don't feel.
नहीं फील होता करेक्ट बट ऑल्सो जब मैं आप दोनों को देखती हूँ ना यू बोथ आर वेरी काम पर्सन्स लाइक
Oh, we are not calm.
That may not be true, Darshita.
We are calm. We are calm only when we are not doing a patient.
oh okay
So we are calm in front of the patient, but what goes on beneath the mask, we know.
Only we know what's happening in the past.
बट ओके बट अगर कॉम्प्लेक्स प्रोसीजर आते हैं जैसे आपने बोला पेशेंट के सामने तो काम रहते हो सो हाउ डू यू मेंटेन दैट पेशेंट के सामने हाउ डू यू मेंटेन टू स्टे काम इन इवन इन कॉम्प्लेक्स प्रोसीजर अगर कोई आ गया
So it's a very subjective thing. Like if I'm performing surgery or a zygomatic implant or kabhi implant nahi बैठ रहा है या something, I know she's there. She'll tap on my hand and she'll say, "Calm down." You know that it'll happen. Something or the other will happen. We
We have a language of our own in the sense where we communicate with each other without talking.
we have some words, some code words that we know that yeah, Baba, that it'll happen. हो रहा है. It'll just take time. And I feel any surgery you do, any surgery, there has to be complications. Complications उन्हीं के साथ नहीं होता जो ज़्यादा surgery नहीं करते. Whoever does surgery has complications, and also for prosthetics, even if the implants are fine, all full mouth, we are doing well, everything is good. Even the last moment, due to some technical glitch in the lab, sometimes prosthetically she has to adjust the whole thing again. That time I'm there, I tell her we postpone our patients after that कि थोड़ा time लगेगा, this that, so we help each other as much as we can. That's how we stay calm. We know that कुछ ना कुछ we will manage. Just stay at it, and I feel that eventually it falls in place.
Learn from him, to be honest, to be able to be calm under a pressure situation. So I don't show it, but he knows that I may be feeling it. Like if everything is not going according to plan. But I think over the years we have learned to,
Jokes.
yeah.
We try to dissipate this thing. You know, कि आज तो लग गए हैं, this is gonna be bad, but we know that eventually we'll manage something.
Yeah. So my next question goes on this only कि when we do FMR cases mainly because I'm seeing that nowadays more. So surgical planning और prosthetic planning दोनों बहुत important है. उसके बिना I don't feel कि case possible ही है to be a best case.
Yeah.
So how do you manage कि surgical planning और prosthetic planning दोनों एक साथ हो because what I see कि अगर हम एक जन अगर प्लान कर रहा है ना तो सब उसके हिसाब से होता है when two persons come तो दोनों का दिमाग individually लगता है.
So initially, when I used to do cases, I never used to involve her for the planning. But then I learned the hard way that it's always better that, especially in full mouth implants, if you're talking, it's better that a prosthodontist is the first person who sees the patient and the last person who leaves the patient. That's something that
Correct.
Julia taught me. She will be the one who evaluates the bite or how the patient, what are the patient's expectations. We have a rule in this clinic that every patient, irrespective how small, if it's a single implant or if it's a full mouth implants, or there are complex zygomatic implants, whatever, every planning or every primary discussion is done only when both of us are there together. So she also sees the patient clinically. I also see the patient clinically. Radiographically we evaluate the patient together. We tell the patient what are their expectations, what we can achieve best for them. Not every case is same. Every full mouth is different. Every full mouth requires a different approach. So according to that, we shift. And I think when we both do it together, there's very little chance of error that can happen. It's not to say complications don't happen, but it does happen. And I don't think there's any other way than to be included in both prosto and nose together. Every case has to go through both of them
Yeah.
for a better outcome for your patient.
That's true because when I was doing this implant, I remember it was my third or fourth case, and my CBCT के लिए I went to OMR department. So when they gave me this, they were like, OS का measurement चाहिए कि prosto का measurement चाहिए. I'm like, what?
How many times you struggled? I would like to say something on that once you
Yeah.
finish.
I was like, what are you saying? इम्प्लांट तो इम्प्लांट है ना, प्रोस्तो को इतना पता है कि 5 mm रखना है एंड ऑल. कहते नहीं नहीं मेजरमेंट क्या चाहिए. मैंने कहा व्हाट आर यू सेइंग. मैंने कहा यू टेल मी व्हाट इज द डिफरेंस बिटवीन दिस. देन दे टोल्ड मी एंड देन आई अंडरस्टूड. बट देन आई
What did they tell you?
कि मतलब नीचे से ऊपर तक it's
What are the
OS.
surgery measures from the anatomy
Yes,
structures
anatomy to
but
upper.
prosto is opposite.
Yes.
First restorative space
Restorative space
and
and
then
then go
below.
there. Yeah.
So yeah, that's that. So hence the primary reason when a patient comes, we sit together with the patient clinically and radiographically here and discuss. फिर हम नीचे से ऊपर भी करते हैं और ऊपर से नीचे भी
So what do you find? मतलब genuinely ये मेरा
So what
question
do
है.
what I think we have learned is that हम लोग अगर साथ में भी plan ना, we can actually give a realistic listening to the patient. Like I have made mistakes where I placed implants where there was very little restorative space.
हाँ.
Now we used to struggle in that case, you know, कि crown कैसे जाएंगी, how to reduce the bone, BD कम है.
Yes.
So then, and in her cases, she'll promise the patient कि यहाँ पे sinus lift हो जाएगा, but probably वो ना, sometimes it's not possible.
Possible.
Surgically, it's not feasible when there's absolute lack of bone. So that way, when we are together, we can at least be realistic to the patient. That this is possible and this is not possible. That is what we have learned. Oh.
Now we've learned to work it out, sit down with each other and with the patient before meeting the patient. When we have seen a case or a patient, we work it out. What is possible? Prosthodontically, मैं ये prosthetically I can do this much, and then he takes it from there what he can do. And before giving a reply or response to the patient, we have discussed it amongst ourselves that what we can give to the patient. हम क्या दे सकते हैं patient को? Is this possible or not possible? Like sometimes the bone looks so good. कितना सारा बोन है, मस्त इम्प्लांट हो जाएगा, बट मे बी रेस्टोरेशन के लिए स्पेस नहीं है, ऑपोजिट टिल्ट हो गया, or whatever n number of reasons could be there. So sometimes even before placing the implants, you have to take care of all other things in the mouth.
Correct.
And then so we have to find the best way to communicate with this with the patient, to the patient, right? Because patient has come for one thing and then we tell him, so it has to be, there's a lot of planning that goes behind between both of us, you know, to be able to sit with the patient and then tell them a treatment plan.
Actually, जो आपने बोला ना, it's I was thinking should I ask or not, but now I am very curious about this question. Is that कि when you both sit together, so there are sometimes disagreement कि ये नहीं ये करना है, ये नहीं ये करना है. So obviously now I'm hearing from you both कि most of the cases you both perform together.
All our cases.
Yeah, so there are disagreements. ऐसा तो नहीं होगा कि नहीं होगा. तो how do you manage that thing कि मतलब it's very professionally मैं बोलूँगी ये वाला चीज़. It's because अगर हम कोई कंसल्टेंट को भी बुलाते हैं, so they give
उनके साथ भी
their
disagreement होता है.
हाँ,
True.
तो वो होता है. तो how to manage?
I think over the years, no, since we have learned also together, undergrad, postgrad, हम सब साथ में ही सीखे हैं. फिर हमारा fields अलग हुआ. And now when we specifically talk about say implants, we have learned implants, we've reached the final destination, but through different routes,
Yeah.
through different roads.
Yeah.
So now what I am, initially there were a lot of more disagreements. पहले
Hmm.
ज़्यादा होते थे, because I was like, yeah, okay, you are reaching here, but you're taking a different route, and why are you doing this, or why? And he used to ask me the same question.
Hmm.
Finally, तो हम लोग पहुंच जाते, but why different? So now I have learned that he has a surgical approach. वो
Correct.
सर्जिकली चीजें देख रहा है और मैं प्रोस्थेटिकली. सो नाउ इंस्टेड ऑफ एन आर्ग्यूमेंट, व्हाट आई फील, वी आर वेरी हैप्पी टू सिट एंड डिस्कस विद ईच अदर, बिकॉज आई फील आई हैव लर्न सो मच फ्रॉम हिम, जो मैंने प्रोस्थेटिकली मेरे मेरे पीजी में नहीं सीखा,
नहीं सीखा.
बिकॉज आई वाज सीइंग इट फ्रॉम वन पर्सपेक्टिव, वन
Yes.
पॉइंट, prosthetically, and he was doing it surgically. So now I think I have learned so much more, and more than unlearned about implants. So I mean, it is.
I personally feel that disagreements are very healthy.
Hmm.
Like, disagreements is constructive criticism. Is
Hmm.
disagreement leaves a scope for learning something new.
Correct.
We as a partner or as a married couple, we have gone home, we have discussed a case till 12 or 1 in the night. We have actually gone and seen stalwarts podcast or their lectures, and then when we have to give each other proof that why we are saying what we are saying.
Hmm.
It helps us not increase our knowledge and increase our pool of ideas. So at the end of it, we try all. If ये केस में अगर जो मैं बोल रहा हूँ वो करेंगे, next केस में we'll do what she is saying,
Yeah.
and eventually we reach to the same thing.
Hmm.
But yeah, so
So I think वो disagreement मेरे लिए ऐसा what I heard और जो मैं उससे result निकाल सकती हूँ वो ये है कि we always grow.
Hmm.
क्योंकि अगर डिसएग्रीमेंट होंगे तो ही हम ग्रो करेंगे ना. अगर ऐसा हो जाएगा कि यार ये तो मुझे सब आता है.
Exactly. Disagreement now has become a part of learning new things.
Hmm.
कि हम डिसएग्री कर रहे हैं तो हम सीख रहे हैं कुछ और, इज व्हाट आई हैव अंडरस्टूड.
Hmm.
ओके, आई विल, एक दिन मुझे नहीं दिखेगा उसका पॉइंट, बट मे बी इन द नेक्स्ट टाइम आई विल see it.
See it.
So
Yes.
yeah, it's a part of, I think it's a process of learning, is what I
Yes.
have understood of.
So I was been reading a book that is Psychology of Money.
Hmm.
So उसमें एक लाइन थी कि never get too attached with your reputation because then you will fall down. अगर आपकी reputation गिरी तो. जो मैं अभी तक we have this all conversation, I understood one thing कि आप दोनों ने अपनी रेपुटेशन को इतनी अटैच नहीं रखा है अपने आप से, जो बहुत अच्छी बात है. एंड दैट मीन्स कि कोई ईगो नहीं है. इट्स समथिंग दैट वी आर जस्ट लर्निंग एंड हम ग्रो हो रहे हैं बट साथ में ग्रो हो रहे हैं. आई थिंक दैट्स अ परफेक्ट एग्जाम्पल. बट बिकॉज आई वॉज स्टडिंग अ बुक जिसमें ये भी लिखा हुआ था कि ईच डे आप कुछ, अगर आप 1% बेटर बनो, जो हम ये डिसएग्रीमेंट की बातें कर रहे थे कि ईच डे इफ यू बिकम 1% बेटर, तो देर आर 365 डेज, तो आप 365 क्वालिटीज ला रहे हो अपने. तो अगर हम डिसएग्रीमेंट कर रहे हैं, अगर जैसे इस कॉन्वर्जेशन में इफ आई से नहीं नहीं ये तो नहीं हो सकता, बट यू से कि नहीं ये हो सकता है, शायद हम जब ये छोड़ के जाए रूम तो आप वो आंसर फाइंड करो और मैं वो आंसर फाइंड करो, एंड वी डोंट
that's
नो.
exactly what we do.
या
I feel what you said, ego and this, we both, at least I can speak for the both of us, we go about life thinking that we are going to learn something new every day, every case, and every case we tell each other, एक सिंगल इम्प्लांट भी आपको कुछ नया सिखा के जाता है, और एक फुल माउथ हो या एक बड़ा पैन फेशियल हो वो भी सिंपल हो सकता है. एवरी केस हैज समथिंग डिफरेंट, and we approach life with gratitude, hoping to learn every day. Like, we never thought that we'll be able to place one implant outside on our own, but we have been blessed that we do our things, and we never think of ourselves that आगे बढ़ रहे हैं या कुछ कर रहे हैं या implants के number बढ़ाने. No, we do every case with 100% effort. Initially we didn't even used to do cases for money. We have done implants for such low cost. Sometimes we've also paid from our pocket to do certain cases because we are interested in that case.
करेक्ट.
Like, I tell you, the first zygoma case that we did outside, उससे हमने कुछ नहीं कमाया. उससे हमने हमारा RBG सेटअप खरीदा जो गन था, which was a very big खर्चा at that time.
Upgrade ourselves, like
We don't
जो चीज
only
हमको,
look
हाँ,
at patients with money, but with learning something new, or a acquiring something new. That is how we look at our practice. That is how we want to look at it. It doesn't mean that it always yields us the most money, but it yields us most healthy experiences.
मनी के अलावा भी हमें और चीजें मिली है while doing those cases
Hmm.
and learning
Yeah.
things.
Failure has taught us a lot. I feel like every
True.
failed case
Yes.
we learn 10 times more
Yes.
than that. And I don't think किसी को भी अपने image से इतना प्यार होना चाहिए, because everyone goes through failure. Anyone who tells you is not gone through failure has not worked.
Not work. That's true.
True.
एंड एक्चुअली ये बात बहुत सही है बिकॉज आई डोंट रिमेम्बर ये शायद कोई तो इंटरव्यू है जिधर या अनुष्का शर्मा शी सेज कि आई वांट कि आप इतने पैसे कमाओ, इतना कुछ करो, इतने वेकेशंस लो कि आप ये समझो कि असली खुशी पैसों में नहीं, असली खुशी अपने आप को ठीक करने में है. सो इट्स यस, इट्स रियली ग्रेट. एंड ऑल्सो मुझे एक और बात आपको बिफोर वी एंड, I really need to say one thing that I was seeing a podcast only of Raj Shamani and उसमें दिलजीत था, and दिलजीत is my favorite, तो उसका कुछ भी आया I don't miss it. So दिलजीत के पॉडकास्ट में he was been asked कि शाहरुख खान में ऐसी क्या चीज़ है जो उसको इतना फेम दे रही है, इतना फेमस बना रही है. So he told सहन शक्ति. भगवान देखते हैं कि आप में कितनी सहन शक्ति है, कि आप कितना ही डिजर्व, कितना संभाल सकते हो अपने आप को, इसलिए वो आपको उतना ही बड़ा करती है. और अगर बहुत ज़्यादा ही आपने उसको नहीं संभाला तो उतना ही नीचे भी गिरा सकती है. एंड वी हैव सीन द केसेस अबाउट दैट. सो व्हाट आई हैव बीन सीइंग इन दिस थ्रू आउट फॉर माय बैचलर, तो चलो ठीक है, वो तो एक लर्निंग था कि हम सबको देखते रहते थे, बट वी यूज टू सी, जो बोलते हैं ना, जो एकदम बेकार काम कर रहे हैं हम उसको देखते हैं, और जो एकदम अच्छा काम कर रहे हैं उसको देखते हैं, और जो डेडिकेटेड है हम उसको देखते हैं. आई फील मैंने आप दोनों को इन डेडिकेटेड लेवल में देखा, कि मुझे नहीं पता पर्सनली कि कौन बहुत अच्छा कर रहा था, कौन बहुत खराब कर रहा था, बिकॉज मैं खुद पढ़ रही थी. बट आई सीन कि यू बोथ नेवर गिव अप. एंड आई विल से फॉर योर प्रोफेशनल एंड पर्सनल लाइफ बोथ, क्योंकि वो जो डिस्टेंस होता है ना, चाहे तुम एक जगह पे हो बट बात नहीं होती है, वो भी बहुत खाती है. सो आई
Both
फील
Yeah. But then you have to decide what is important at
What
what
is
time in
important.
life.
Yeah.
If you have to do it, you have to do it. And if it's the right partner, then it's free. If they're not, anyways, gonna leave.
anyways. So one last question, उसके बाद एक fun segment करेंगे. So the last question is that what is one investment जो आप दोनों ने individually when you earn money खुद से, तो वो पहला इन्वेस्टमेंट आपके ऊपर आपने क्या किया
Personally,
पर्सनली?
I, like you quoted Anushka Sharma, it may sound different, but I got myself a personal trainer
वाओ,
because I needed some mental and physical training
वेरी गुड.
because it was so exhausting. That 5 years of UG, then NEET, and then 3 years of PG. It's like you're on a continuous chal raha hai sab kuch na kuch, and then just again getting into the outside world and just starting off. I needed a break and to build myself again before I can जो भी मैंने सीखा है, इतनी knowledge और जो भी चीज़ जमा किया, to be able to display it or utilize it in the best possible way. So that was my first, apart from my bags and my skincare and my makeup. So that's yeah, all the other things
but
also. But
ये तो हम इन्वेस्टमेंट करते हैं. See,
but getting
the
myself a physical trainer,
yes,
like a personal trainer,
yes,
was the investment. So that was my investment
That's
that I
really
did
good.
in myself. I would like to
and
say.
yours?
Apart from the things in the clinic, mine
It's
was
your
the
own.
car. It made my life very simple. Going to consults, I used to travel by train everywhere, from Kolaba to Borivali to Dahisar to everywhere. But the first thing, my personal investment, which I used the most, was a car, because it really made life simple.
Simple.
Made me, maybe I can do less consults, less clinics, less more time in traveling, but it makes you for a better quality of work whenever you reach a place. So for me, it was my car, was my
But
first
जो
investment.
आपने अभी कार का बोला ना, आई हैव जस्ट सीन वन रील जिसमें ऐसा था कि एक इट्स गोज विद कार ओनली, कि एक थे, आई डोंट नो द पर्सन नेम, वो बैंकरप्ट था एंड ही जस्ट मतलब मर्सिडीज का शोरूम था एंड ही जस्ट पास बाय फ्रॉम इट एंड ही कॉल्ड नेक्स्ट डे कि मुझे मर्सिडीज की टेस्ट ड्राइव लेनी है. उसने ली, टेस्ट ड्राइव ली, एंड देन नेक्स्ट डे ही बाइड ऑन अ लोन. व्हाट हैपेंड वाज उसको डबल द इनकम मिला, डबल ही स्टार्टेड वर्किंग हार्ड एंड डबल ही डिड. मैं आप दोनों के एग्जाम्पल से ये बोलना चाहूँगी, जो आपके पर्सनल इन्वेस्टमेंट है, यू यू बोथ you both did on something. It showed कि how hard work you have to do it. और ऐसे हम बोलते हैं ना कि भगवान जी हमारे खर्चे बढ़ा दो ताकि हम उतना बड़ा करें. सो आई लव जो आपने कार पे किया और आपने पर्सनल ट्रेनर पे किया. इट्स समथिंग दैट वी शुड डू इट.
100%.
वी शुड, क्योंकि हम अगर आई एम पता नहीं, मैं बहुत ज़्यादा इंटरेस्टेड हो गई हूँ कि टॉप 10 लग्जरी थिंग क्या होती है. सो फर्स्ट
So luxury is subjective depending if we're using our parent money or not.
no, it's your
It's
own
on our
money.
own money, then luxury is a car, personal trainer, these are all luxuries.
यस यस इट इज. और वो होता है, और जब हम ये लेना चालू करें ना तो हमें पता चलता है कि हम कहाँ
Land करते हैं.
लैंड कर रहे हैं. सो इट्स रियली ग्रेट. आई होप मैं जल्दी करूँ.
You
You will.
बट आई हैव ऑलरेडी प्लान समथिंग एंड माय मॉम इज लाइक नहीं नहीं नहीं. मैं लाइक मना लेंगे. So
हो
it's
जाएगा.
okay.
It's always a little different
Yeah,
between
it
the parents and the
But it's okay. We'll see.
Generational gap.
तो है ही.
सबको डील करना पड़ता है यार, वो हो जाएगा.
So now it's a fun segment.
Okay.
ठीक है. So who is more likely to be
Oh.
late?
You want to point yourself?
This takes time, guys.
उनका रिएक्शन ने हमें बता दिया.
Me?
Fashionably late is
No.
what I like to call.
It's criminally late.
Guilty.
Okay. वैसे गर्ल्स लेट होनी चाहिए.
है ना?
हाँ.
Isn't that true?
Yeah.
I'm a girl. I'm a
It's a
prostitute.
concept.
I
That's
have
okay. Yeah. You should be. So buy a new dental gadget.
That's it.
Convincing a patient most easily.
We always most of the times do it together, so we
Hmm.
don't realize किससे convince हुआ.
Stay longer at the clinic. वो पॉइंटर ने वो रिएक्शन ही इतना अच्छा दे रहे कि मैं समझ पा रही हूँ.
I have to manage things here. कितनी
Yeah.
चीजें होती है यार. So yeah, and I love to be. This is my comfort
Oh.
zone also.
That's nice. Forget where they keep an instrument.
All the time, every day.
I just lost 2 yesterday.
What?
Implant kit में से 2 component यार. Patient करते करते किधर चला जाता है? I don't understand.
I used
यार वो तो महंगे भी होते हैं.
कितने महंगे होते हैं?
मुझे अभी तक नहीं समझा था, बट अब समझ
Now you
रहा है.
understood?
अब कोई मुझे इम्प्लांट का ये छोटा सा कवर स्क्रू भी बोल देगा, मैं बोलूंगी
I have
भाई.
a diary. You maintain a diary. Write it down with date and time. Who you have given it to and take it back.
That's nice.
This I learned again in prosthodontics.
ये आपको सीखना है.
मैं उसको लेके जाता हूँ, वो लिख देते हैं.
अब मैं 2 जन के डायरी में लिखूंगी.
2 जन के लगते हो. Nice. So if you could swap a specialties of your both for a day, would you do that and why?
Like become an oral surgeon for a day.
Yeah.
Okay. I think I'm good with prostho.
She was not.
So
I can't do Costco.
तो मतलब आप दोनों नहीं कर सकते. That's okay.
No, because I'll tell you why. At least for me, because I've seen such a good oral surgeon in my eyes that I feel I never can match up, or I don't want to. I like somebody है जो बहुत अच्छा कर सकता
Costco
है.
is not for me. Fine details,
ऐसे cross तो
occlusions.
बहुत है.
Guys, what is this? Teaming up against me.
We are-
Once you get the hang of it,
No, but we are saying कि आप कितने प्रोफेशनल हो
we should
and
ask.
स्पेशलिस्ट हो.
You should ask them who got her counters.
that's a
You?
story for another day. Can you believe a prosthodontist को एक oral surgeon ने crown cut सिखाया?
Wow.
But I would like to clear this. भाई लोग देख रहे हैं. This was in UG undergrad, 3rd year में एग्जाम आ रही थी. And again, मुझे चाहिए कि मुझे सब अच्छे से आए. Like it has to come. And I was not satisfied जो मुझे demo मिला था उससे कि नहीं यार मैं नहीं सीखी, मुझे और सीखना है, मैं YouTube खोल रही हूँ. He's like अरे मैं तुझे सिखाता हूँ. And he was in the same demo with me. हम दोनों ने same teacher से demo लिया, but I'm not satisfied that I've learned enough. He's teaching me, and till today that's a joke. Like oral surgeon in Prosper मुझको सिखाया how to do a
That's a big thing, but wow.
tooth preparation.
Hotel.
Just
चलो
correcting.
इट्स ओके हम उसको ओके टी और कॉफी जितना मुझे लग रहा है आप कॉफी तो वो नहीं तो
She's
टी
coffee.
में
I'm tea.
व्हाट
Yes, like again, like I was a coffee person always. I still am, but now finding the love for some ginger and lemongrass tea as well.
ओहो वेरी नाइस
And he is none person, no tea, no coffee, nothing.
हम कैसे जाएंगे फिर कॉफी शॉप
Milkshake पीऊंगा.
He would rather have a milkshake. मैं tea भी coffee भी like I'm from
बट
inside.
जब मैं और दी गए थे ना कॉफी शॉप शी ऑर्डर मिल्क शेक आई एम लाइक अरे मैं कहाँ
You must have had a daily dose
I'll
of
tell you,
coffee.
I calculate my daily dose of caffeine tea इतना ही जा सकता है. And the second thing, after 3 p.m. or 4 p.m. in the afternoon, I don't take any coffee because then it disrupts my sleep cycle. Moving on.
ये मुझे बहुत डांट पड़ चुकी है मैं वेयर आई वर्क ना तो वो तो मुझे चिढ़ाते हैं पेशेंट किया कॉफी पेशेंट नहीं किया कॉफी अब लाइक
बट ये होता है, you know, this is how हमारा yes पीजी ऐसे ही निकला था हमारा, and तुम्हारा भी ऐसे ही निकलेगा अभी.
इट्स ओके मॉर्निंग क्लिनिक और इवनिंग क्लिनिक
For me, morning clinic is easier because I'm fresh. I would like to give complex cases in the morning. I'm a surgeon, so early intubation, early all that works for me. Evening I have to do now because now I've taken a job at DY. But if not, then morning clinics are
मॉर्निंग क्लिनिक्स आपका
मेरा आंसर इट्स नॉट मॉर्निंग और इवनिंग. माइन इज स्लाइटली डिफरेंट. आई प्रेफर
Afternoon.
11 to 7 clinic, like not late evenings, not early mornings. I think that arises from the work that I do. I don't need to like पीजी में कभी कोई पेशेंट को बहुत जल्दी नहीं देखना पड़ा. There is no emergency per se in my work. It is
Correct.
more convenient and cold cases अपने टाइम पे कर सकते हो. So I'm more of 11 to 7 kind of a person.
करेक्ट
So
आई
that's-
एग्री विद
yeah.
यू सो क्राउन और विनियर्स आपके लिए
Again, case dependent होता है, but मुझे ज्यादा मजा क्या करना आता है veneers, because of the change, the drastic change a very small thin veneer can do to a patient, to a face. I mean that I like the thrill of it. एक छोटी सी चीज and look at the difference if done correctly. So I like.
So I know your answer for the next one, but still I want to ask implant your bridge.
Ask me that question.
No one should answer bridge in this question.
You have to say this
There's
out loud.
only one right answer, that is implant.
But implant cannot go in every case, right?
It can.
So for us, when is bridge an option? When implant.
Now, when the
One of the
patient
reasons
is
is not practically possible, either systematically for the patient, economically, or due to
There are
any
three-
constraints.
there are only three reasons where we don't place an implant. One is economic reason, if patient is non-affording. Second, if the patient is systemically compromised, like his diabetes or
Diabetes.
immunodeficient. And if the patient has adverse habits like smoking, heavy smokers, where we know the prognosis of implant is bad, only then. Otherwise, we always.
But
prefer-
most of the doctors फेल भी करते हैं मतलब बहुत ज्यादा जो स्मोक करते हैं उसमें भी करते
So we
हैं
do it.
That is
We
a
still do it.
calculated risk that
But we have
to
an
take.
entire performer for guarded prognosis where we inform them that their habit reduces the success rate by 50%. If the patient is willing to take the risk, then we go ahead with it, or else we go for a bridge.
So one word to describe your spouse.
One word.
Yes. They both was not ready for this इसलिए
Can I say competent?
it was nice one.
No, because that's what came to my mind. In all aspects, I can see personal and professional. I feel like wherever I fall short or I fall, या मैं जिधर भी लड़खड़ाती हूँ,
ये कवर कर देते
it
हैं
could be personal, professional, or some third thing out of the world.
It's very nice.
So I think competent is the word. Be it my any personal issue, time का late हो जाना या काम नहीं रह पाना कोई situation or anything. I feel like wherever I'm ending or falling short, he's there to pick me up from there. So I think competency.
Yeah, wow.
For me, it's dedicated. She's dedicated to everything she does.
Yeah, I agree to this.
Everything she gives 110%. Sometimes I have to snap her out of it. Juju, bus now,
We are on a vacation.
I
So,
agree to
we had
this.
gone to a vacation. We have spoken to the whole lab person on the beach drive. I don't know where we wanted to see. So she's very dedicated to her work, to her personal life, to everything.
Very good.
Dedication.
एंड दैट्स वेरी नाइस. इसके लिए रिलेशनशिप ज्यादा अच्छी चलती है वैसे अगर डेडिकेटेड रहे तो. सो वन वर्ड दैट डिस्क्राइब योर प्रोफेशन.
All encompassing. Is that too egoistic for a prosthodontist? That's what I believe, that prosthodontics is in dentistry when it comes to it, like I said earlier also, it is all encompassing. Like in most fields of dentistry, it's like the base of dentistry, is what I believe personally, because I love my subject and my profession.
For me, this thing is fun. It's my whole
Real
thing is
safety.
fun.
आपके लिए तो फनी है.
Funny. It's all
फनी
fun.
है.
Really fun है surgery.
मैं
I think we should bring psychomatic
I
implant है.
I can agree. मैं आपको बोल रही हूँ ना, मैं भागते भागते गई थी उनके पास कि मैंने ना ये नाइफ रिच किया, मैंने D1 किया, ये हाँ तो ठीक है.
It's fun.
क्या ठीक है, मेरा दुख रहा है. It's like हाँ ठीक है. मैं
So I'm
okay.
lifting weights.
I am already doing that.
Basically, that I realized that I'm lacking in this area, and to be able to perform better and give my patients better, I
It's
need
so
to have
much-
some strength.
So much fun for me. Sometimes Joy has to pull me back. Stop now.
I have to. Oscar. This is our action. 2 times tap on this when you do the
Stop.
patient. Like we need to communicate or stop or.
That's nice.
Yeah.
Code language.
So that's what I meant when I said earlier that we have a code language.
Code language.
पेशेंट को नहीं, हम या तो सक्शन टिप से
मुझे ना एक
टैप्स
गाना याद आ गया. आंखों से बताना इशारे.
एंड दोस आईज.
वो मुझे समझ में आया, वो गाना याद आ गया इसमें से.
अभी पेशेंट के सामने तो बात नहीं कर सकते ना यार, रुक जाओ बस और करो. हाउ डू यू से दैट बट स्टिल कम्युनिकेटिंग,
Yes.
बिकॉज पेशेंट को नहीं समझेगा कि हम वो उनके अच्छे के लिए बोल रहे हैं. वी आर यूजिंग two pairs of eyes
Correct,
and two
correct.
different
Joy
streams of
doesn't
knowledge.
need to give a indication. When breath sounds to the mask, you come to know she's hyperventilating now.
अरे वो
Okay.
तो अभी आपको ही समझेगा,
We
वो
are too
हमें
close-
नहीं.
We are too close to the sinus, or we are too close to the nerve.
When I want to take an X-ray, now how do I say so? उसका भी कोड है.
नहीं,
X-ray.
बहुत अच्छी चीज है ये. बट वैसे बिकॉज ये ना मतलब मेरे असिस्टेंट के साथ भी अब बन रही है कि दे अंडरस्टैंड. अगर मैंने ऐसे देखा, दे अंडरस्टैंड कि मुझे कुछ प्रॉब्लम हो रही है, अब संभालने की बारी आ रही है. सो दे अंडरस्टैंड दैट
And
एंड
it really helps. It
It's-
होना
it
चाहिए किसी के
helps.
साथ तो केस करने के लिए.
करेक्ट. सो वन लास्ट क्वेश्चन, वन मैसेज फ्रॉम योर साइड जो आपको बोलना है टू ऑल यंग डेंटिस्ट इंक्लूड मी.
I think मैं ये मेरे पर्सनल एक्सपीरियंस से बोलूँगी what has helped me, having a good support system in any form or way helps you get through whatever you're going through. So try to find good people around you in the form of friends, mentors, family, partner, anything, and that will help you to get through, because काम
Correct.
तो आ ही जाएगा. If you're dedicated and you're doing it regularly, you will learn. So I think you need a good support system is what I would like to tell them. Find your people, find your support system, and that will help
Correct.
you get through most things in life.
For me, the message would be do what you love and love what you're doing. That's it, and then you will do good. in
अरे एक
everything.
चीज है, आई हैव सीन लड़कों ना एक लाइन बोलते हैं और सब निकल जाता है उसमें. हम लड़कियां पूरा वन लाइन पूरा पैराग्राफ दे
Before the
देते हैं.
podcast is told me, ये जो knowledge का नल है ना तेरा, उससे एक एक बूंद ही निकालना, नहीं तो लोग grasp नहीं कर पाए. That's what he's told me. So I was prepared to speak less during the podcast.
And he was prepared to speak more.
I'm like, okay, कम बोलूंगी मैं भी.
Oh, something that they should know. Like,
Yeah.
Easy to grasp, easy to understand.
करेक्ट, वो तो बात सही है. But thank you so much. It has been really a
Thank you.
fun podcast.
Same here, Dasha. That was so nice to have you with us and
Yes.
great questions.
Finally हमने कर ही लिया.
Finally, we did it.
बहुत time
After so much back and forth, अब हम May से decide करेंगे
May
when is that
से.
conference है.
Good things take time. That's okay.
You have to be the finale.
हाँ करेंगे.
Season 1.
सीजन 1 फिर सीजन 2 आएगा जिसमें हम थोड़ा सा डेंटल
Upgrade
के
to the
क्वेश्चंस डाल देंगे सो दैट वी कैन हेल्प बट ऑल्सो ये जो भी डिस्कशन या जो भी हमने बातें की इट्स ऑल our own personal life के experience. It's not that we are commenting on anyone या किसी भी चीज पे.
These views are our views. What has helped us in life. And
Yes.
what has worked for us. It might not work for everybody,
Hmm.
but this is what works for us. So,
True, these are
Yes.
our personal experiences
Personal experience.
and our personal, opinions and thoughts and what has
Correct.
shaped us. So this is extremely personal.
So thank you so much.
thank you.